Leading an active life combined with healthy food is essential to good health. Hello, I am Hani Patel.
I am Kadam Poshya.
I am Deval Puran.
And I am Shia Wadi.
We are highly honored to take this opportunity on behalf of Gajera International School to welcome you all to our talk show of the day. Today is 4th of February. This day is marked as World Cancer Day to raise awareness about cancer and to encourage its prevention, detection and treatment. In India, the incidence of cancer is increasing day by day. Therefore, it is important to step up cancer literacy and knowledge among the population. So, on this auspicious day, Gajera International School has taken an initiative to spread awareness by organizing this talk show.
For this World Cancer Day, we have with us Dr. Nikunj Vitlani, a very knowledgeable oncosurgeon who is current with new techniques and understandings. He is a consultant oncosurgeon at Bharat Cancer Institute and Research Institute and at Basil Oncocare. He has set a record by performing non-stop surgeries on over 50 cancer patients for 101 hours on 4th February 2011.
He was awarded the Best Oncosurgeon Healthcare Award by the Honorable former Chief Minister of Gujarat, Sri Vijay Rupani. His name is also registered in the Limca Book of World Records for being a part of free oral cancer checkup of 2,119 people. It's an honor to have such an animating personality like you with us today. Thank you, sir, for accepting our invitation and becoming our chief guest for today's talk show. Now, without any further delay, let us start with our healthy discussion.
Hello, sir.
Hello.
How are you?
That's fine. How are you?
I am good. Sir, my first question is, how is cancer caused?
As said, the cancer can be caused by the many factors. Still, the science doesn't have a complete answer. But habit is one of the major factors. Like in our region, we are seeing the oral cancer is one of the common cancers, and majority of the oral cancer and throat cancer are caused by the tobacco. In our region, people have a habit of chewing tobacco, which is cause the common oral cancers. Also, the smoking tobacco like cigarettes and bidi, they are the responsible for the lung cancers and the cancer of the GI tract. So, cancer is majority caused by the habits like tobacco and alcohol. But other than this, sedentary lifestyle, dietary factors like we are increasing junk food in our diet, oily foods in our diet, we have a overweight and lack of the exercise is also the major contributing factors. Along with this, the stressful lifestyle that also plays a major role. Because of the stress, we have a downward trend toward the immunity. So, stressful life is also one of the major contributing role. Other than this, there are the polluting factors we can say, like we are more of using the chemicals in the farming. We are having a majority industrial pollution, air pollution. So all are these common factors which lead to the cancer's rate increasing day by day.
Second question for you is, what does cancer have symptoms? Which are they?
Yeah, majority cancer have symptoms in early stage, but we need to find out that symptoms in the early stage. There are around we can say 200 types of the cancer in our body from head to toe. So there is a different type of the cancer in our body from head to toe, and all the different cancer has a different symptoms. So we can say like few common symptoms I can say. Okay, any new swelling in the body can be the cancer. Any new ulcer in the body can be the cancers. So whenever the person who is chewing the tobacco and he has ulcer in his oral cavity, which persists for more than 7 days, we need to warn. Any cough which is more than persistent for more than 21 days, we need to warn. Any bleeding in the cough is also one of the major symptoms. Weight loss, anorexia means loss of the appetite is also one of the factors. In GI tract, in abdomen, blood in the stool, blood in the urine, alternate diarrhea, constipation. So all these are the symptoms of the cancer. It can be. There are the moles over the skins. Everywhere we have birthmarks. So, but there is a change in that birthmark size, shape, and there is ulceration on that birthmark. Can be the signs of the skin cancers. So there are the varieties of the symptoms from head to toe of the different cancers. But if we are aware with our body, that there is something new developing inside our body that we need to take care. If you find there is something new in the body which is persists for more than 5-7 days, like I can say any ulcer inside the oral cavity, cough more than 20 days. So these are the symptoms. If persists more than 7 days, then you need to consult a nearby doctor to further investigation.
Okay, sir. Sir, do we get cancer from what we eat?
Yeah, definitely. I already mentioned. Okay, as per the we are moving from the our Indian lifestyle to a westernized lifestyle, and we have changed the dietary habits a lot. Like particularly in your young generation, you are all habit of the Swiggy and Zomato, pizza, burger. Yes or no? Yeah. So majority we are moving towards the junk foods. So these junk foods are not made for our body. We have decreased the green leafy vegetables or the what we can say is what we are available from the nature source. So that diet portion is decreasing day by day in our diets. So that is a major problems. Along with that change of the diet, we are getting the overweight and lack of the exercise. So all these major contributing the cancer.
Thank you, sir. So next question for you is our stress level a concern for cancer?
Yeah, definitely. As I mentioned, because of the stress, immunity goes down. As we have seen in corona also. The people who have a minimal stress, they don't affect the corona. So for the any disease, our body immunity plays a major role. If our immunity is good, then we can fight with any disease in the which are coming to our body. Same way in the cancer also, whenever the stress level is high, people's stress level is high, they have a high chance of getting the cancer.
Thank you, sir.
Sir, according to you, when should an individual consult a doctor?
As I mentioned, any symptoms in your body which is persist for more than 5-7 days, you should consult a doctor. But along with this, I can say there is something called screening protocols. Any female which is she is more than 35 of the age, she has to compulsorily undergo the mammography every yearly. She has to undergo the pap smear test every yearly. So these are the we can call the screening test. So what is a screening test? Screening test is basically applied to the normal population. It is not for the diseased person or the symptomatic persons. So every normal human being has to undergo mammography test. So what is mammography now? I can say first of all. So mammography is basically a specialized X-ray in which for the breast, in which we can find out the small tumor inside the breast which is a centimeter size or less than a centimeter size, earliest. So if there is some cancer is going to develop or developing inside the breast, we can find out it early with the help of the mammogram. Same way, there is something called pap smear test that is made for the cervical cancer. So in pap smear test, we take the few cells from the cervix and we examine in the microscopes. These cells are the normal or it is a cancerous cells. So these are both the screening tests. So every female has to undergo mammography and pap smear test every yearly after the age of the 35.
Okay, sir. Sir, now we would like to know about its stages. What are the stages of cancer and what do they mean?
That is the utmost important question, because in day-to-day life in our patient they are asking which stage is cancer is this, but they doesn't know what is the importance of the stage. That is more important. So usually all the cancer are divided into the 4 stages. Normally I can explain in a simple language. The stage 1 is a cancer which is localized in that area only. If we are taking the example of the breast cancer, so stage 1 is a very small tumor which is residing inside the breast only, and that is less than 2 cm of the size. Stage 2 cancer is that is tumor size is somewhat more and in the same organ. Like in breast cancer, if tumor is more than 2 cm but less than 5 cm size and inside the breast only, then it is called the stage 2. Stage 3 is a tumor spread outside the organ in loco-regional area. We can say lymph nodes. So that is called stage 3. So in breast cancer, if tumor more than 5 cm in size or patient having a lymph nodes in the axilla, that is this portion. So that called the stage 3. And stage 4 is a cancer grow over there also and it spread inside the body also, like lungs, livers or the bone. So any other area, then it is called the stage 4. So now what is the importance of this stage? That is a more important question. Stage 1 and stage 2, we can say it is 100% curable cancer. So if we detect the cancer in a stage 1, we can give a patient a result up to 90-95%. In stage 2, we can give the result of up to 80%. Stage 3, the result comes down straight forward to up to 50%. And stage 4, that goes down directly to the 20%. So as the stage increase, the disease burden inside the body increase. And after getting the treatment, our result is going down and down. As we have already discussed with the madam in the morning, okay, what is the difference of result in a Western country and what is the difference in the result of the Indian countries? So treatment availability is everywhere is same. Whatever the treatment is available in US, it is available in Surat also. But what is the difference? They are getting the cancer results overall is 60 to 65% in US. And in India, we are getting just 30 to 35%. Why this difference comes? Just because of the early diagnosis. The majority of cancer diagnosed in the US are the stage 1 and stage 2 cancers. And majority cancer in our area, we are diagnosis are the stage 3 and stage 4. So because of this stage 3 and stage 4 cancer, our overall result goes down. So basically, people having still the fear in the mind, the fear of the cancer in mind, they don't come up with the checkup. They have an ignorance of the self, for their own body. If there were some symptoms inside, like there is some ulcer in the oral cavity, some tumor in the breast, they don't go to doctors for the checkup early. So whatever the symptoms in body, you develop the new symptoms, you have to go to the doctors as early as possible. Then and then we can find out the cancer in an early stage, and then we can get the results. So as stage increases from stage 1 to stage 4, disease burden inside the body increase, and day by day we are from stage 1 to stage 4, our result goes down. So that is importance of the stage. Do you understand?
Yes. Sir, now I would like you to tell us about what are the new advances in detection and treatment of cancer.
As such, it is a very wide topic. So cancer is basically in treatment portion we discuss. So the cancer treatment is divided in 3 parts. Cancer surgery, that is I am an oncosurgeon, so I do the cancer surgery. Radiation oncologist, they provide the radiotherapy, and medical oncologist, they give the chemotherapy. So in all the 3 fields, there is a lot of advancements is going on. Another way I can say, the highest research in the world is going in the field of the cancer nowadays. Why? So as we were discussing, the day by day cancer incidence is increasing. Like if we are seeing the numbers, in 2020, the Globacon data has suggested that in India, the total numbers is 13,50,000 new cancer patients in 2020, which was 10 years back, was just a 6.5 lakhs. So we have almost doubled from the 10 years. And still within next 10 years, we are going to still double the numbers from this size. We can say in USA, the number is like 350 people are getting the cancer in 1 lakh population. In India, still this number is still down. It is 150 per 1 lakh population. So if we are don't awake on this stage, we are reaching the US number within 5 to 10 years. So there is a huge bomb is going to blast, and that's why we need to increase the cancer awareness. We need to diagnose the cancer in an early stage, and we need to treat it properly. So in all 3 fields, there is a heavy research going on. For the cancer diagnosis, I already mentioned, like for the female cancer mammography and pap smear tests, they are the very well beautifully developed tests which can diagnose the cancer in an early stage. After the mammography, still there is advancement is going on. Like now comes the 3D mammography. So in which, like conventional mammography, there was a breast was squeezed between the 2 plates. So there is a somewhat pain was there. But now the 3D mammography is one of the beautiful techniques where the squeeze of the breast is gone. So patient doesn't have a zero pain. After that mammography, there is something called thermomammography. That is also a lot of tests is going on that thermomammography, which detect the cancer cells very early rather than mammography. MRI of the breast. So these are the advancement is going for the diagnosis. So like diagnosis, we can say the earlier CT scan machine were not available. Now there is a lot of advancement in the CT scan machine also, MRI machine also. So all these tests are now easily available in the Surat city also. Same way in the treatment. Earlier the treatment was we are doing the radical surgeries. We are removing the whole organs. Like in the oral cancer, we remove this jaw, we remove all these things. But nowadays with the advancement of the radiological investigation like CT scan and MRI, we detect the cancer which is confined to that area and we remove the small area. So patient having we can preserve the jaw. So patient doesn't have a problem with deglutition, with swallowing, with speech. So that problems is going to decrease day by day. So if we detect the cancer early, then we can give a better treatment or better result to the patients. Same way in the surgery also there is still advancement like in abdomen cancer we have laparoscopic surgery, robotic surgery, thorax we can have a thoracic surgeries. For the breast cancer we have something called sentinel lymph node biopsy. For the head and neck cancers we are still the people who need to remove the jaw, we can go for the reconstruction. We made up the jaw from the leg bone. So these are all the advancement is going on inside the surgical field. Same way in medical oncology also that is what we provide is chemotherapy. In chemotherapy field earlier there are a lot of side effects with the chemotherapy like hair loss, anorexia, nausea, vomiting, weakness. But because of the advancement or understanding of the cancer is increased day by day. So after chemotherapy comes is a targeted therapy after comes is a nowadays something called the immunotherapy. So all this with the therapy we are getting much better results and with less side effects. Same way third branch is radiation oncology. In radiation also there are the day by day improvement in technology and machines. And the newer machine is coming with breast cancer we have something called the latest machine is tomotherapy. So in this tomotherapy we are concise the area which we need to focus on for the radiation. So we preserve the normal area and that way we can increase the result and decrease the side effect of the cancer. So in all the three fields, surgery, medical oncology and the radiation oncology, lot of research are going on and day by day this research is coming in the way in the clinical practice. So it will help a lot to the us and to the patient also.
So my next question is about treatment. What is the goal of the treatment? Is it to eliminate the cancer or to make the patient feel better?
That is very good questions. As a cancer surgeon or as a cancer doctor, our first goal is to cure the cancer. But along with that, our second priority is not only that we need to allow that patient, but that patient should be functional, socially and economically acceptable to the society. So in all the three ways that human being should be live his normal life. That is our motto. So by curing the cancer, we need to put that person in the society where he can live his normal life, socially and economically acceptable life. He should not feel any way that my life is not, there is no importance of my life. And nowadays I am putting a campaigning in the society forward saying that today also in Times of India I have given us on the same topic writings. Okay, the society has to understand that these people are the hero. They have a fight a disease which is a cancer, which is very big disease. They have a lot of sufferings and they are coming out of this disease. So we have to, as a society also, we have to help them. There are many incidents we are seeing. The people are firing from the jobs after the cancers. So that should not be happen. If that man is capable of doing the job, then you should hire him. In fact, we need to support these people and we should hire more and more these people. So we can create a more example in the society. The patient after clearing the cancer can live the normal life. We can give a positive message to the society. We can give a message to the another new coming cancer patients. They can, after the treatment, they can also live normal life. So our aim is to not only cure the cancer, but after curing the cancer, we are putting the patient into the normal life back.
Sir, my final question is, will there ever be a cure for this disease?
Cure of the cancer, as I mentioned also earlier, we can cure the cancer, but still we are saying these patients are the cancer survivor, not cure for the cancers. Once the patient got the cancer, he has a higher chance of to get the recurrence of the disease and higher chance to get the second cancer also, because of many cells inside the body has already been damaged. So that person can get the second cancer or that person can get the recurrence of the first cancer also. So cancer cure word still is dilemma. Science has not a perfect answer of this, and maybe a single branch like allopathy cannot be an answer of this. So we need to go for the holistic approach along with the science. Then and then in future we may find a cure of the cancer.
Why is 4th February is celebrated as World Cancer Day? How did it start?
It started in 2000. In 2000, WHO, that is the World Health Organization, who cares about the health of the world, they have a meet in the Paris, France in 2004 February, same day, and they generate a concern about the cancer. In 2000, era of the 2000, they have suggested a warning that cancer is going to day by day increase. They have suspected whatever the cases in 2000 that would be the 500 times by the 2020. So they issued a big warning, and from that day they decided to celebrate the 4th February as a World Cancer Day. So on this day, as a whole, we as a team, caregivers, NGOs and schools, colleges, all the organizations come on the single platform to raise the awareness about the cancer in the society. So we can educate our society about how the cancer can cause, how we can prevent the cancer, how we can treat the cancer, and how we can get the results. So all this awareness we can start to spread, or on this day we are ready to spread in the society. So we are celebrating 4th February as a World Cancer Day.
Okay, thank you, sir. Just when the caterpillar thought the world was over, it became a butterfly. So let's hope there comes a day when cancer is just a zodiac sign. With this, we bid our gratitude towards Dr. Nikunj Vitlani, who took out his valuable time and joined us today for this candid talk. On behalf of entire Gajera family, we would like you to thank you for the difference you make in the lives of your patients. Your kindness, sincere caring, and concern make everything better, and our great encouragement. We hope our show will create awareness among our viewers that will lead to early detection, which is important in the management and treatment of cancer, and also prevention by making necessary changes in lifestyle. Lastly, we will thank our honorable trustees and our encouraging team of Gajera International School, Uttarakhand, including our respected and dignified principals, vice principals, educators, and technical staff for taking this initiative and organizing this successful awareness program.